The private elevator to the hospital boardroom hummed softly as I adjusted my Armani suit. 5 years ago, I'd walked out of medical school to the sound of my parents' disappointment. Today I was walking into their hospital as its potential owner. Dr. Sarah Williams to see the board, my assistant announced as we entered. The room fell silent. My mother's hand froze on her stethoscope. My father, the hospital's chief of surgery, stopped mid-sentence. Neither had seen me since that night I'd told them I was leaving medicine to start a healthcare technology company. Sarah. Mom whispered, her stethoscope clattering to the table. What are you doing here? Saving your hospital, I replied coolly, taking my seat at the head of the table. Though I'm sure that's not as impressive as actually becoming a doctor. The board members shifted uncomfortably. Everyone knew the story, how Dr. James and Dr. Catherine Williams' daughter had thrown away her medical career. What they didn't know was that while my parents were telling everyone about my failure, I'd been building the country's most innovative healthcare technology company. This meeting is for serious investors. Dad's voice carried his familiar dismissal. Not medical school dropouts. Actually, the hospital's financial advisor interrupted. Ms. Williams, Dr. Williams, represents MedTech Innovations. They're our most promising potential buyer. MedTech. Mom's face went pale. The company that's revolutionizing hospital management systems? The same, I smiled, opening my laptop. Though I'm sure you'd know more about it if you'd bothered to read any of my emails over the past 5 years. Dad's jaw clenched. You're claiming you own MedTech? Not claiming, father. I founded it. Built it. Grew it into a billion-dollar company while you were telling everyone I'd ruined my life. I pulled up our company financials on the boardroom screen. And now, I'm here to decide if your hospital chain is worth saving. The numbers flashed across the screen: MedTech's valuation, our technological innovations, the hospitals we'd already acquired. My parents watched in stunned silence as their failure daughter displayed success beyond their comprehension. Your hospital chain is losing $2 million a month, I continued professionally. Your technology is outdated, your management systems are inefficient, and your patient satisfaction scores are dropping. You need more than an investor. You need a complete transformation. Wait a minute. Dad started to stand. Sit down, Dr. Williams, I commanded, surprised when he actually did. Or should I remind everyone that your position as chief of surgery doesn't outrank the hospital's potential owner? The board members leaned forward, sensing the family drama unfolding before them. 5 years ago, I continued, I sat at our dining room table and explained how technology could revolutionize healthcare. You called it escapist fantasy, and told me to focus on real medicine. I clicked to the next slide: MedTech's patient care statistics. Our AI diagnostic systems have reduced misdiagnosis rates by 60%. Our management platforms have cut administrative costs by 40%. And our patient engagement apps have improved satisfaction scores by 75%. I looked directly at my parents. Tell me again how that's not real medicine. Mom's hand trembled as she reached for her fallen stethoscope. Why didn't you tell us? Tell you. I laughed softly. Like you told the hospital board when they asked about me? What was it you said, Mom? She's taking time to find herself? The boardroom was silent now, watching this family reunion turned business negotiation with rapt attention. Well, I stood up, smoothing my suit. I found myself. And now I'm here to find out if your hospital is worth my investment. I clicked to the next slide, displaying the hospital's declining metrics in harsh red lines. Let's talk about why Metropolitan Hospital chain is failing. And no, Dad, it's not because of modern doctors lacking dedication, as you love to say at medical conferences. Dad's face reddened. Our methods are proven. Your methods are obsolete, I cut him off. Just like your opinion of my career choice. While you were clinging to paper charts and manual processes, I was developing AI systems that can predict patient complications hours before human doctors notice symptoms. The financial advisor cleared his throat. Dr. Williams, the younger Dr. Williams, is correct. Our operational costs are unsustainable. Unsustainable. I pulled up more data. They're catastrophic. You're 3 months from bankruptcy, 6 months from losing your accreditation, and 1 year from complete collapse. Unless what? Mom asked quietly. Unless you accept MedTech's offer. Complete technological overhaul. Modern management systems. And new leadership. Dad stood up so fast his chair toppled. You want to remove me as chief of surgery? Want to? Oh, father. I'm going to. It's non-negotiable. Kept my voice level. Just like your decision to remove me from the family when I left medicine. We didn't remove you, Mom protested weakly. Really? Should we call Aunt Helen and ask about last Christmas dinner? When you told her I wasn't invited because Sarah's choices don't align with family values. The board members shifted uncomfortably. Your family drama aside, the financial advisor interjected, MedTech's offer is extremely generous. Generous. I smiled. No, it's calculated. Just like every other decision I've made since you told me I'd never succeed without a medical degree. I pulled up MedTech's success metrics. Our hospital management systems reduce costs by 45% in the first year. Patient outcomes improve by 30%. Staff satisfaction increases by 50%. But most importantly, I paused for effect. We eliminate outdated hierarchies that value titles over talent. You can't just walk in here and take over, Dad sputtered. Actually, I can. And I will. I distributed tablets to each board member. These show real-time simulations of how our AI systems could have prevented 3 major incidents in your ER last month, including the one you blamed on nurse incompetence, father. The board members studied the data, their expressions shifting from skepticism to amazement. This is remarkable, one whispered. Of course it is, I replied. I may have dropped out of medical school, but I never stopped trying to save lives. I just found a better way to do it. Mom's hands trembled as she swiped through the simulation. Sarah, these results are what I tried to show you 5 years ago. Before you called security to escort me out of the hospital when I attempted to present my initial prototype. The room went silent again. That incident had become hospital legend, the chief of surgery having his own daughter removed from the premises. The offer expires in 24 hours, I announced, standing up. Though given your financial situation, you might not want to wait that long. 23 hours later, I stood in my penthouse office overlooking the city's medical district, the lights of Metropolitan's hospitals twinkling below. On my wall hung my unfinished medical degree next to my company's first patent, a perfect representation of choosing innovation over tradition. They're here, my assistant announced through the intercom. All of them. All. I raised an eyebrow. Your parents, the board, and... She hesitated. Your brother James. I smiled. James, the successful child. The one who'd followed the proper path through medical school, residency, and into our parents' good graces. The one they'd held up as an example every time they mentioned my unfortunate choices. Send them in. And bring the files on James's department performance. They filed in like patients receiving bad news, appropriate, given that I was about to perform major surgery on their careers. Mom still wore her white coat like armor. Dad clutched his tablet like a shield. James stood at the back, probably wondering why he'd been summoned. Welcome to MedTech. I gestured to the chairs. I trust you've reached a decision? The board has voted, the financial advisor announced. We accept your offer. All terms. I asked, though I already knew the answer. Bankruptcy tends to eliminate options. All terms, he confirmed. Dad stepped forward. But we need to discuss the leadership transitions. No, we don't. I pressed a button and my executive team entered, each carrying tablets loaded with transformation plans. Your leadership ended the moment I signed those papers. Including yours, James. My brother startled. What? I'm not even part of hospital administration. No, but you are head of cardiology. A department that, according to our AI analysis, has the highest error rate and lowest patient satisfaction scores in the entire chain. That's impossible, Mom protested. James is an excellent doctor. Is he? I pulled up his department's metrics on my wall screen. Or did you just assume he was excellent because he followed your prescribed path? The numbers didn't lie. Under James's leadership, cardiology had become the hospital's worst-performing department. Our AI system flagged 127 near misses in your department last quarter, I continued. Cases where serious complications were barely avoided. Know why they were avoided? Because nurses and residents caught mistakes that you missed while you were busy giving interviews about being the youngest department head in hospital history. James's face flushed. You can't judge medical care with computers. Actually, I can. And do. Every day across hundreds of hospitals. I stood up, walking to my patent wall. See these? Each one represents a way technology can make medicine better, safer, more efficient. Things I tried to tell you about while you were mocking my computer games at family dinners. Sarah, Mom stepped forward. We can work together on this. Like we worked together when I brought you my first prototype? The one Dad called toys for kids who couldn't handle real medicine? I turned to face them. Oh, Mother. We're not working together. You're working for me. All of you. Assuming you meet our performance standards. I pressed another button and more executives entered with documents. These are your new contracts. Significantly reduced roles, mandatory technology training, and performance metrics that will be monitored by our AI systems. I smiled. Welcome to modern medicine. This is revenge, James accused. No, brother dear. This is progress. Something you'd understand if you'd spent less time bragging about your title and more time actually improving patient care. I walked to my window looking out at the hospitals that now belong to me. You know what the irony is? Everything I've built, every system, every innovation, every improvement, it all came from wanting to help patients. The same goal you claimed I abandoned when I left medical school. We were trying to protect you, Dad said quietly. No, you were trying to control me. To force me into your narrow definition of success. I turned back to them. How's that working out? I picked up a tablet displaying Medtecha's global impact statistics. Last year, our systems prevented 50,000 medical errors, reduced healthcare costs by $3 billion, and improved outcomes for over 1 million patients. Tell me again how I'm not helping people because I don't wear a white coat. Mom sank into a chair, her own white coat suddenly looking less like armor and more like a relic. Why didn't you tell us what you were building? Tell you? Like you told your friends I was finding myself, when actually I was raising millions in venture capital? Like you told the hospital board I was exploring options when I was developing systems that would revolutionize healthcare. I pressed another button, and the wall screen filled with news headlines about Medtecha's innovations and acquisitions. Your daughter, I gestured to the screen, the one you said was wasting her potential, just bought your entire hospital chain. How's that for potential? Dad cleared his throat. The staff will resist these changes. No, they won't. Because unlike you, I understand that healthcare isn't about titles or traditions. It's about outcomes. And our outcomes speak for themselves. I distributed more tablets, these showing individual performance metrics for every doctor in the chain. Starting tomorrow, these metrics will be public. Every patient will be able to see their doctor's success rates, error rates, and satisfaction scores. Including yours, James. My brother paled as his statistics appeared on the main screen. Welcome to transparent healthcare, I announced. Where success is measured by results, not relationships. Where innovation matters more than inheritance. And where, ironically, a medical school dropout is about to teach all of you how to be better doctors. What happens now? Mom asked. Now you learn what modern healthcare actually looks like. You'll report to my team, follow our protocols, and watch as I transform your failing hospitals into centers of innovation. I smiled. Consider it the medical education you never gave me. I pressed a final button and security appeared. You'll receive your new assignments tomorrow. For now, my team will show you out. Oh, and Mom? That white coat you're so proud of. It's obsolete in our digital hospitals. Like most things you valued more than your daughter's dreams.